My name is Jamie, and today I'm going to be talking about infertility. So my target audience is focused towards adults and those who are interested in becoming knowledgeable in infertility, and also couples that want to begin to start a family. It's important that they use this information and become aware of all implications that can come about when starting to have a child. So my first reference was used to explain the definition of infertility and also the different types of infertility. My next two references were for my facts and statistics I want to talk about, and then my final reference is the psychological needs that need to be taken when dealing with infertility, along with extra information as well. So my first learning objective is, what is infertility? And it's biologically incapable for women or a man to contribute to contraception, and a woman who is unable to carry her pregnancy through full term. Some other things to consider is if the woman's under the age of 34 and she's been trying to conceive for over a year with no contraception, it can be considered infertility. And also trying to conceive for over a 6-month period with no contraception, and the woman's over the age of 35. And this age is crucial because that's when the quantity of the eggs for the woman start to decline. My second learning objective is the different types of infertility. So infertility is a couple that's been unsuccessful in having a child when trying for over a year. Primary is having never been able to become pregnant at all. Secondary is having difficulty conceiving after being pregnant once before, but they could have also had a miscarriage or an abortion prior to that. Combined infertility is when both partners are infertile, and unexplained infertility. There's been about 15% of cases where tests show no abnormalities, and this happens when abnormalities are most likely present, but they're just not able to be detected when testing. Just some facts and statistics I'd like to share. There's about 60 to 80 million couples around the world that are affected with infertility, and the males contribute to 20 to 30% of these. Infertility has the most stressful experiences, and there's also major psychological damages that happen to the couple as well. And Louise Joy Brown was the first born in the United Kingdom through in vitro fertilization, also known as IVF, and that was in 1978. And for my final learning objective, there was a study done that showed that couples need to face psychological needs along with guidance and a little extra information to get through their struggles with infertility. Emotional distress management is the first, and this is when a female participant of the study stated, "I cannot live or work. I feel so sick that I cannot even manage myself. I only sit in a corner and cry. I want God to just give me some peace." Also, marital counseling should be taking place. Some people point fingers at the other couple. There's verbal arguments and they blame, and it's more common for the men to blame than the woman. Sexual counseling should be taking place, and this is when complications in the relationship come from having to follow an intercourse schedule and they feel like their sexual relationship is more forced. And also family counseling. It's good that they have the support from their family, but they tend to want to not be involved in family interventions, and they like to just kind of hide their feelings. And then some extra guidance and information that is needed would be financial counseling. This is the most challenging factor a couple faces when dealing with infertility, is the cost of it. And one gynecologist from a study mentioned, the medical team should explain about the problems, especially the treatment expenses, to the couples in the beginning so that they can take measures without having any false hope or stress added onto it. Legal counseling should be taken, and this is when couples who need assistance from a third person when it comes to the reproductive methods, and they have to refer to legal counseling units in the infertility centers. And this could be taken when there's an oocyte or embryo donation, as long as gestational surrogacy. And the purpose of this is to show the importance of the legal counseling and the patient's deliberate decision making for reproductive treatments, and just to make sure that everyone follows the rules and regulations and make sure there's a smooth process. And lastly, treatment counseling. People can be unaware of the treatment options and the side effects that come along with it. And it's also recommended to hold training courses in infertility centers. It provides written information, and it gives the couples some more information through websites, and they also recommend having educational movies playing while in the centers as well. And there are my references.